just wanted to add my thanks not only to the witnesses, but to all the men and women who work in the field for your agencies during this extraordinary time. We do know that this has been an unprecedented amount of work, and we are very, very grateful. Having said that, I just want to add a caution because while the time for an after action report on what was done well and what wasn't is for after the pandemic, I think there is general agreement that we needed to establish our goals earlier and that we still have some ways to go in terms of being transparent about what our goals for things like PPE and testing are. There's a difference between saying we've worked really hard and done all these things and knowing that we've actually met our need. There's a difference between saying, let's see what we can do, and here's what we need to do. And so that's what my questions are really focused on. I'll start with Administrator Gaynor. And again, I want to thank you and everybody at FEMA for all the hard work you've been putting in. But I've had a consistent frustration, and we've shared it with you, and I know it's shared by the chairman and other members of this committee, about the administration's inability or refusal to publicly lay out clear numerical projections and goals for its COVID-19 response. I've been asking for months now for the administration's estimates of how many N95 masks and pieces of other personal protective equipment our country needs. It took over a month of pressure from this committee to even get verbal answers to these questions. And it wasn't until late last Friday night that I got anything in writing. And even now that I have this document, which you all produced to my staff Friday night, the administration still says we can't make it public. There are real questions about this document, but I don't see the utility of asking about it if the public doesn't have access to it at the same time so they can follow our discussion. The American people deserve answers to these basic questions: how much personal protective equipment we need and what our plan is to get there. So Administrator Gaynor, why is the administration refusing to make this document public? Public scrutiny is critical to evaluate these projections, how they were developed, whether they account for real needs in nursing homes, hospitals, schools, and businesses. Why can't I share this document with my constituents?
Yes, ma'am. Thanks for the question. So I don't know of any prohibition about sharing the slides. So if you have an interest in sharing those slides publicly, go ahead and do so. We provided those slides to you and the committee for your use, and if that includes sharing those with your constituents, I don't see a prohibition against it. When it comes to understanding PPE, and I'll defer to the Admiral here in a minute, but when it comes to understanding PPE, scarcity, a demand for things that some sectors have never had a use for before, it has taken some time for us to understand that. And so, early on, we wanted to understand what usage was against what pre-COVID numbers look like. Now that we're moving into opening government, what do those numbers look like? Elective surgeries, dentists, all these things are new and additive to the problem. So as we go, we learn more. We'll update those slides. They'll be more comprehensive.
Director Gaynor, I thank you. But I will just say, and I have limited time, your staff explicitly told our staff that we could not share these documents publicly. So I am glad for your commitment today, but I just want to be clear on the record that we were told we could not share these documents.
Yes, ma'am. I apologize for that.
Thank you. I'd like to move on to a question to Admiral Polupchak, please. And I will just say, again, it would be better to forecast what you think the needs are as you have discussions with different sectors so that we can then develop a plan to meet the need. Admiral Polupchak, related to my question to the administrator is the fact that critical facilities still face severe shortages. Federal data released last week show that nursing homes around the country still do not have the personal protective equipment that they need to keep people safe. More than 500 nursing homes in our country lack any N95 masks, and more than 250 don't even have surgical masks. Admiral, I appreciate that this is a challenging situation, but those numbers are completely unacceptable. About 40% of all US COVID-19 deaths are residents or workers at nursing homes or other long-term facilities. And in New Hampshire, over 80% of deaths are in long-term care settings. The federal government has to do more. What are you doing to remedy the lack of personal protective equipment available to nursing homes and other long-term care facilities across the country?
Thank you. That's a great question, and I
And I can't hear the Admiral.
that's a great question. And I appreciate your passion for the vulnerable. So we're doing several things. One, in our prioritization scheme, the first priority is public hospitals, then the VA, private hospitals, and then nursing homes. So nursing homes are and then one of our top priorities as we work to get items where it's needed and when it's needed. Secondly, we've instituted a project to bring personal protective equipment to every single registered nursing home in America. That's 15,408 nursing homes, delivered directly to their front doors. That's millions of surgical masks. Millions.
And when is that going to happen?
We started that project building the volume of supplies necessary in April. We started deliveries in May, and that will run through weekly. That we'll be getting deliveries of several weeks worth of PPE as we go through August and into September. And
So Admiral, and I realize that I'm over time, but Admiral, what I am looking for is a plan that tells every nursing home in America when they are getting the equipment they need.
Yes, ma'am. So we give every governor every Monday when the vice president has a governor's call, I give them a state breakout with every single nursing home in their state and the address, including the amount of supplies and when the item is being shipped and if it's been delivered. So we have a great communication with
as you know, right? As you know, we still don't have this equipment in many nursing homes.
So, ma'am, one of the things that the Healthcare Ready Network is now producing is an input of nursing home information in there, working with Administrator Seema Verma. And I see regularly inputs from nursing homes where less than 2% of nursing homes that are reporting say that they don't have a week's worth of personal protective equipment. I would really love to sit with your staff to go through that information and understand where you're saying that there's hundreds of nursing homes that don't have it, because the data being collected, and I'm being from the Healthcare Ready Network, is showing a very small amount. And once we see those numbers, we go work with each one of those nursing homes to make sure that they have PPE.
Well, I would appreciate following up with you on that. And Mr. Chair, if there is a second round of questions, I'd appreciate being able to ask them. Thank you.
Okay, Senator Rosen.